Welcome to Learning Unit number 3. In Learning Unit number 3, we're going to talk about a couple of things. So we are in the process of studying vulnerable populations. So we're going to look further at social determinants of health as they relate to the ethical concepts of social justice and healthcare equity. We're going to then look at trauma-informed care and ACEs, which are adverse childhood experiences that many vulnerable populations experience. And then we're going to finish this unit through the development and submission of a ScreenPal video discussion of the first 5 chapters, including the preface and introduction of Compassionomics. So it is a busy week, but it's all going to really help you as you go on further with your group. It really lays the foundation as you go on with your specific vulnerable population. So you're going to be reviewing all of the links, videos, readings. You're going to read chapters 4 and 5 in Compassionomics. And again, your video discussion, which we're using a ScreenPal, is going to be on all of the readings thus far, including up to chapter 5. And if you have time, you can review the next assignment, the mind map. But you know what? I wouldn't even go on to that right now unless you have a lot of time this week, because otherwise just focus on this week and we'll talk more about it in the intro video next week. So you're completing your video discussion, again, using ScreenPal. We no longer have Flip. Flip is no longer in existence. So ScreenPal is actually an excellent way to express, because you can use both your image, you can record yourself on the camera, and or you can just or show like a PowerPoint or slides or any information that you have on your screen. So it is what I use to create these videos, and we have the directions all listed for you. So don't hesitate to learn this new technology if you haven't used ScreenPal in the past, because I think you'll find it very beneficial. And then you're going to participate in discussion number 3. So those are the things. Let's get on a little bit more with readings. So if you click on there, it's just going to tell you to complete reading chapters 4 and 5, a reminder of that, a video on social determinants of health. It's short, it's sweet, and it's very accurate and a great consolidation of the different social determinants of health. This is a newer article that I found, and I guess I would say if you are only going to do one thing in this course, to please read this and maybe even print it out and then come back to it in the future. I took this one figure out of this article, and it asks us to reflect ourselves on questions regarding social determinants of health. And when we're dealing with, and this was specific to clinical oncology, but I think these are questions we could ask in any aspect of nursing. What are some common stereotypes a nurse may have about the patient? Which of these stereotypes do you believe to be true? Remember, we all have implicit biases. Why do you believe these stereotypes are true? Remember, we have received a lot of information throughout our lives, and especially that shared with us from our family members may really impact on how we think. What social determinants of health factors should be considered when providing care to the patient? Not enough nurses ask this question, and that's why we have a course on vulnerable populations. And what medical factors should be considered when providing care for the patient? So here is the article. It's entitled Healthy Lifestyle Behaviors. And I really think you're going to enjoy this article and highly recommend that you print it out and come back to it in the past. And here is a shorter article. It's more of an opinion piece, but does the general public understand what social determinants of health are? I'm finding many undergrad students really don't understand social determinants of health, and maybe other grad students don't as well. So now we're asking the general public, as we make health policy revisions and laws, we're asking the general public to better understand social determinants of health. So this is a really neat article. Again, very brief, not a research article. This is a video on trauma-informed care, and then we finish with, I know a lot of readings, but we finish with teen ACEs and mental health. And I think you're really going to also find this to be of value. So I tried to pare down and take away some things, and I found that I just couldn't take away any of this content because it really is essential for our foundation. So in discussion 3, no reply is required. You're going to focus on, it's asking you to begin by telling us why you chose this population, then discuss the social determinants of health that impact on your population in the general context of social justice and healthcare disparities. Integrate how ACEs may impact on your vulnerable population. And again, as always, don't forget to cite your readings of this week, both in text and at the end of your post, as you always are doing. So that is the discussion board. And then I'm going to come back and introduce you to the assignment that is also due this week, ScreenPal video discussion. So if you were on this assignment tab before, you will see that this is open. And in fact, I'm going to go into the student view, and because this learning unit still isn't open, I'm going to put myself in the student view, if you just take a minute, so that you're seeing the same as what I do. And you'll see that course assignments, you don't have to come back here. You can just click on that link below in learning unit number 3. But for purposes of me sharing with you your view, let me open course assignments. And you've completed the assignment number 1 in learning unit number 1. Now this is Compassionomics number 1 ScreenPal video discussion, and this is what is due in learning unit number 3. So when you click on and you're going through learning unit number 3, you're going to see that there is a ScreenPal video discussion. And when you open it on Blackboard Ultra, you'll want to click on View Instructions. Yours may say something slightly different. It may say Attempt number 1. For some reason, Blackboard Ultra was giving us some grief, so that may be what you see. But you're going to open up the instructions to video number 1, and you can print it out. Of course, you can download it or just view it. And while it's very small to view, let me just tell you what you're going to do. You're going to create a ScreenPal video, and you're going to format it similarly to a TEDx talk video. You're going to be limited to 5 minutes. You're going to start by introducing yourself, give your title, number of years experience, so we can all learn a little bit about you. And then based upon the readings from Compassionomics, first 5 chapters and the preface, I want you to answer the following questions. What 2 reasons, let's make that a little bigger, huh? What 2 reasons do you think that you and or your nursing colleagues have failed to treat patients' colleagues with compassion? So just reflect back. If you prefer not to talk about yourself, then maybe think about your nursing colleagues. Why do you think some of them have failed to treat patients or their other colleagues with compassion? On pages 24 to 25 of our Compassionomics, the authors list 5 main reasons why healthcare providers fail to treat others with compassion frequently. Please choose at least one of these reasons from the list. If you believe that there is another reason that isn't listed, you could share that reason as your second reason. But I want you to at least attempt to get to choose one of the 5 reasons first that are on these pages. And then if you think of another reason, go ahead and share that with us. And then speak to a gem that you read in these pages, the first 5 chapters, that really resonated with you. This is your chance to share your excitement about the readings. And then, so we're going to hopefully make this a little bit smaller. And when I make this smaller, you're going to see that on the bottom, there is a place to submit your link. So part of the reason I ask that you do a screen pal is because it provides you with a link that easily can be viewed by your colleagues, by me, and it's just I've had more difficulty with other types of software for a link for a video discussion. You can even click on this link and just add your link. And once you add your link, you can insert it. That's all you're sending to me. So that is the final assignment for Learning Unit number 3. Again, you can find it under our course assignments, but it also will be found in Learning Unit number 3. So have a great week. Any questions? Please don't hesitate to ask, to reach out to me. And I thank you for all of your hard work and for going through these readings this week.